Welcome. Let's talk about when it's appropriate to order a spirometry or a pulmonary function test. So a few times that you want to do it is when you want to evaluate someone for dyspnea, chronic cough, chronic sputum production as well, especially in patients who are smokers or smoking history, then patients with fatigue or especially exercise-induced fatigue. The other time you want to check it as well is when you're dealing with interstitial lung disease, patients with pulmonary fibrosis and so on, and pre-op evaluation in patients who are former smokers or current smokers. So these are the few times that you really have an strong indication to check a spirometry in patients. Now, a tip to note in patients when you get a false negative or when you're expecting it to be positive and you get a false negative, it's notorious in patients with asthma and also in patients based on their effort. So if the patient's effort wasn't strong enough, you're not going to see the obstruction because they actually have to blow out as hard as possible for you to detect the obstruction taking place in their lungs. So there may be false negatives there. Some tips that I would hand out at this point is to avoid using the spirometry and the PFT as a standalone tool to make a clinical assessment or decision. You have to combine it with the subjective symptoms and even radiological evidence. So if someone seems that they're getting worse and all you have is a 50-50 or a mild change in the PFT, I wouldn't immediately blame their lung disease as the cause of their deterioration. Make sure, for example, if they have interstitial lung disease, that it corroborates their symptoms along with CT findings as well. Because don't forget, the PFT is effort and technique dependent. So be aware of that. So just to recap, when to order spirometry: when you're dealing with dyspnea, when you're dealing with fatigue, when you're dealing with patients with chronic cough and chronic sputum production, following up on patients with interstitial lung disease to assess the severity of disease, because the low FVC or forced vital capacity may be a trigger for lung transplantation. The other one, apart from pulmonary fibrosis or interstitial lung disease, is sarcoidosis as well. That's commonly done, so or post-op or post-transplant patients as well. So anyways, those are the few indications for getting a spirometry. Thank you.